Hello everyone, my name is Harry Freeland. I am the Executive Director of international NGO Standing Voice. Thank you for giving me this opportunity today to present our work to the British Association of Dermatologists. I am going to speak today about our skin cancer prevention programme, hereafter also referred to as the SCPP. This is a joint project between the Regional Dermatology Training Centre, Standing Voice and the Pierre Fabre Foundation. I aim to give you an understanding of the programme, how it works and how we have managed to expand it at scale relatively quickly. I will briefly take you through its growth to date and its planned expansion between 2021 and 2027. Standing Voice is a human rights NGO that exists to protect the welfare of people with albinism in sub-Saharan Africa, with teams in Tanzania, Malawi and London. SV has UN observer status and is the chair of the committee in Tanzania overseeing the National Action Plan on Albinism. Albinism is a genetic condition that reduces melanin in the skin, eyes and hair, causing visual impairment and vulnerability to skin cancer. Approximately 1 in 3,000 people in Africa have albinism, 7 times the frequency of Europe. People with albinism are stigmatized for their unique appearance and violently persecuted in Africa. Beyond their health needs, the majority of our patients face additional challenges in accessing education, housing, employment, justice, and political representation. Witchcraft beliefs that the body parts of people with albinism can bring wealth and fortune have led to hundreds of reported attacks and killings across Africa. Here you can see the distribution of attacks in sub-Saharan Africa against people with albinism. Tanzania and Malawi are the worst affected countries on the continent. To tackle the wide range of challenges faced by people with albinism in Africa, Standing Voice delivers programs in dermatology, ophthalmology, education, livelihoods, and trauma recovery. These programs are interconnected and designed to be easily upscaled so they can reach thousands of people with albinism in the countries we work in. Skin cancer is widely accepted to be the greatest threat to life for this group in Africa. 8 years ago, in response to this crisis, the Skin Cancer Prevention Programme was launched with 3 small clinics in northern Tanzania. This programme, which has been supported by the Pierre Fabre Foundation since 2016, now provides free dermatological care to 40% of people with albinism in Tanzania and has successfully expanded into Malawi. This network of clinics, operating in hospitals and health centres every 6 months, provides patients with skin examinations, cryotherapy, health education, sun protective items such as sunscreen and wide brim hats, and referral for surgery. The programme is built to be low cost and is carefully embedded within government structures and aligned to government expenditure for future adoption. Recognised as best practice by the United Nations, it's now the largest and most comprehensive programme of its kind in Africa. Following the success of the Phase 1 project, we have recently secured funding to begin Phase 2, which will see us expand dermatology services across Tanzania and Malawi between 2021 and 2027. Following programme evaluation and patient feedback, we have defined our objectives for the Phase 2 project as follows. Expand the service to reach approximately 95% of Tanzania's regions and 70% of Malawi's districts. Create a holistic philosophy of care integrating optometry, welfare, and psychosocial support. Implement a new health information system to facilitate patient care, research, and publication. Today, the Phase 1 programme provides comprehensive dermatological care to 3,945 patients in Tanzania and 773 patients in Malawi. An additional 3,455 patients are reached in Tanzania through sunscreen distribution and health education only. The programme operates a network of 127 clinic sites covering 15 regions in Tanzania and 7 districts in Malawi. Since 2016, the SCPP has tripled in geographical size and patient reach. By the end of phase 2 in 2027, we will be covering 31 regions of Tanzania and 24 districts in Malawi. This means that a person with albinism in all regions of Tanzania and most districts of Malawi will have access to dermatological care. This table here shows our dermatology targets by 2027. By the end of phase 2, we aim to provide dermatological care to 12,570 patients across both countries. In brackets, we show the baseline figures for 2021. We're now going to look at how the service has been built. This diagram demonstrates the wide range of government and CSO stakeholders we see as absolutely essential to deliver this service. A major role of Standing Voice has been to identify, train, and bring together all these different actors to form one cohesive programme. The SCPP will train 2,000 frontline workers to lead the expansion of this project. These individuals range from dermatology officers to community health workers and Albinism Association leaders. This Venn diagram demonstrates an example of how partners work together in the SCPP to achieve its objectives by leading on the following areas. Ministry of Health is responsible for providing hospital facilities and covering the salary costs of dermatologists and clinical staff. Central hospitals such as KCH in Malawi or RDTC in Tanzania are directors of clinical care, leading clinical training and managing referrals for advanced surgery. CSOs and health workers are responsible for patient mobilisation and communication and advocating for patients at the community level. NGOs such as Standing Voice is responsible for the coordination of all stakeholders, training and programme quality control. Similar roles and responsibilities apply for both countries. Before expanding the service to new regions, we work with local authorities to map PWA populations and identify stakeholders to join the programme. Our objective is to ensure clinic sites are positioned closest to patient homes so they can be accessed by as many PWA as possible. Dependent on the PWA population size and its geographical spread, on average, we open between 4 to 6 clinic locations per region, or in Malawi's case, per district. Once new medical personnel have been identified to join the programme, we deliver a series of training events to enrol these stakeholders into the SCPP. We deliver 3 types of training. Training for dermatology officers and clinicians on identification and management of skin cancer. Training for dermatology officers to deliver minor surgery. Training for health workers, local leaders, and social welfare officers on mobilisation and advocating for people with albinism. We have developed a wide range of educational resources to build the capacity of patients and service providers. Here you can see a picture of a manual of best practice that we have developed in partnership with the IFD and ILDS to support dermatologists and other health workers managing patients with albinism in sub-Saharan Africa. The manual has now been translated into French and through a new collaboration with the IFD and ILDS is soon to be distributed across Francophone Africa. This year we have transitioned to a new electronic database to better support our large data sets, enhance patient care and facilitate evaluation and research. Our new health information system enables doctors and other health staff to enter data directly onto tablets, minimising the risk of human error. We have designed a system for them that can operate offline. This year, the new database has been introduced across all clinic sites in Tanzania and Malawi. We plan for this data collected on the same population over many years to lead to a range of scientific publications. Here you see a clinic layout. We can see up to 100 patients during a single clinic day, which requires very careful management of patient flow. Data is collected at each station as patients move through the clinic. Now I'm going to briefly walk you through the patient journey. When a patient arrives at a dermatology clinic, they are invited to the registration desk. If they're a new patient, they'll be asked a series of questions relating to basic personal information, such as name, address, how they travelled to the clinic, and who has accompanied them. If they're an existing patient, most of their data will be in the system already, but certain questions may be asked to ensure patient information is up to date. After patients have been registered, they are seated in a waiting area. Once a sufficient sized group of patients have gathered in this area, a sun protection education session begins. During this session, patients receive training on understanding albinism, understanding skin cancer and its development, prevention measures, which involves learning how to apply sunscreen. And these talks are followed by a Q&A. Following the education session, patients are called into a private consultation room where they receive a skin examination. Dermatology officers have access to each patient's medical history through the electronic database on their tablet. If any precancerous lesions are identified during the examination, the patient may be given cryotherapy. During the consultation, the dermatology officer will fill out a clinic examination form on a tablet for each patient they see. This form includes data fields for the screening of each body part, number of AKs, and whether any cryotherapy has been administered, clinical diagnoses, as well as questions about the patient's sun protection behaviours, including what sun protective clothing they're wearing and how often they apply sunscreen. After patients have completed their consultation, they move to the distribution table, where they're given a 6-month supply of sunscreen, along with other sun protective items, including wide-brimmed hats, umbrellas for mothers with babies, and sunglasses. At this station, they are also asked a number of questions to measure their knowledge about albinism, skin cancer, and self-care, which they have learned earlier in the clinic during the education session. Patients who have been referred for treatment are informed about any logistics relating to their upcoming referral. Should the dermatology officer identify any suspected skin cancer, they will make a provisional diagnosis within the database, take photos of any suspicious lesions, and make a referral for biopsy and further treatment. Referrals will be made to either a district hospital for a minor surgical procedure or one of the central referral hospitals for more invasive surgery or radiotherapy treatment. At the end of each regional clinic run, the list of referral patients and associated images of lesions is reviewed by a team of consultant dermatologists from central hospitals to ensure the correct referrals have been made. Unfortunately, we see many new patients attending clinics for the first time with advanced tumours. Standing Voice works with hospitals to help support and coordinate palliative care for patients. This can be particularly challenging in African countries where it is often culturally taboo to speak about death, even for doctors. We work with academics and medical professionals to publish research findings on the SCPP. This includes ongoing research funded by the Wellcome Trust, investigating patient agency. In collaboration with the RDTC and Moshi, we have provided patients with summarised data on their skin health and have supported them to develop responses to that information using performance art. Patients then presented these performances to an audience of stakeholders, handpicked by them, such as dermatologists and other Ministry of Health officials. From this project, we are learning how information can best be made accessible to our patients and the impact of this on patients' control over their own health. Our work is supported by a medical advisory committee consisting of international dermatology experts from 7 countries. These experts support our work in a variety of ways, including research, training for clinicians, supporting the development of training manuals and educational booklets, and fundraising. We are always looking to connect with new experts who might be interested in supporting our work. This project, of course, would not be possible without a coalition of supportive partners and funders, some of which you can see here. Through our partnership with the Regional Dermatology Training Centre and the Pierre Fabre Foundation, we've established the largest skin cancer prevention programme in sub-Saharan Africa, which is saving thousands of lives in Tanzania and Malawi. We're immensely proud of this achievement and we're excited about its continued growth in the years ahead. If you're interested in learning more about our work, please do contact us. You can reach us on info@standingvoice.org. Thank you so much for listening, and we welcome any questions you may have.